Nancy Pelosi, Obamacare's best path to affordable health care. House Speaker Nancy Pelosi voiced doubt whether the Medicare for All bill would provide as much coverage as Obamacare, according to an interview with The Washington Post. Pelosi told the WAPO that she did not know if Medicare for All could deliver what it has promised, before saying she would work to improve the Affordable Care Act instead. Pelosi's remarks come after President Donald Trump sparked a new healthcare debate when the Department of Justice decided to support a federal judge's ruling that Obamacare is unconstitutional. Last week, the Justice Department notified a federal appeals court that it approved an appeals court decision stating the entire Obamacare statute is unconstitutional. Back in December 2018, a Texas judge ruled that the Affordable Care Act, otherwise known as Obamacare, was unconstitutional. But many on both sides claim the GOP's failed effort to repeal Obamacare in 2017 was one of the reasons for the party's loss of 40 House seats in the midterms. Pelosi said she was agnostic on Medicare for All, adding that she believes that when most people say they want Medicare for All, they really mean health care for all. The House Speaker claimed that those who enjoy employer-based benefits under Obamacare would lose out if Medicare for All becomes law. "Show me how you think you can get there," she told the Post. "We all share the value of health care for all Americans, quality, affordable health care for all Americans. What is the path to that? I think it's the Affordable Care Act, and if that leads to Medicare for All, that may be the path." According to CNBC, the concept of single-payer health care became more mainstream after Senator Bernie Sanders, of Vermont, made it a principal focus during his unsuccessful run for president in 2016. The Medicare for All bill proposed by Sanders, who is again running for president in 2020, would create a national health insurance program that covers every U.S. citizen. Many other presidential candidates, including Senators Kamala Harris, Democrat California, Cory Booker, DNJ, Elizabeth Warren, DMAS, and Kirsten Gillibrand, DNY, supported Medicare for All and signed on to Sanders' legislation in 2017. Lawmakers in the House also showed support for universal health care after more than 100 Democratic members signed on to a single-payer bill unveiled by Representative Pramila Jayapal, Democrat Washington, in February. Pelosi is not alone in her hesitation to support Medicare for All. Republicans and other Democrats warned that millions of people would lose their employer-based health care under the proposed bill. Sanders' office did not immediately respond to CNBC's request for comment on Pelosi's statements. Pelosi, who was instrumental in passing Obamacare through her first speakership in 2010, also wondered if Medicare for All would be too expensive, noting that it currently has a $30 trillion price tag. "Medicare is not as good a health benefit as the Affordable Care Act," she told the Post. "So, if you are to do Medicare for All, you have to improve the package, and when you improve the package, you have to have more money."